Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a new 4-episode series with Betsy Wischer, a board-certified nurse practitioner who is doing some really important and cool things in women's health in Northeast Wisconsin. Betsy has a background in labor, delivery, and the NICU, and now owns WishLane, where she focuses on supporting women through everything from hormone shifts to pelvic floor concerns, especially during perimenopause and menopause. What we love about Betsy is that she doesn't dismiss symptoms, minimize concerns, or tell someone that their symptoms or discomforts are just normal aging and that they have to live with it. If something feels off, she takes it seriously. Outside the clinic, Betsy is a mom of 2, she's married to her middle school sweetheart, and she loves unplugging through hunting, reading, crafting, building Legos, and more. We're excited for you to learn from Betsy. She is so fun, and you're going to love her in these episodes. Let's get started.
Hey guys, welcome back to the Motherhood Alliance podcast. We are back here with Betsy Wischer. We are super excited to have you back here, Betsy.
Thank you.
We had an awesome episode talking about your story and what WishLane is all about, but perimenopause was our topic. And we're going to kind of dive even deeper into that in this episode. We're going to also dive a little bit deeper into pelvic floor and also intimacy as well. So just a little disclaimer here, we might be talking about some more adult topics. So if there's little ears listening, you may want to just consider that, pop that earbud in instead. But first of all, walk us through those hormonal changes of perimenopause. Like, what does normal hormone flow look like before it happens? And then, we kind of talked about how it can be fluctuating greatly during. And then what does that end result in menopause look like?
Yep. So we have so many different hormones that are cascading. And even before perimenopause, they are rotating and cycling. Like, that's how we get our cycles. So your estrogen's changing, your progesterone's changing. That's how your body knows when to have a period and when to get ready for baby. Like, that's normal. What happens, though, is that those numbers start to decline. So even when they do cycle, we're not hitting the same peaks, but now our lows are even lower. So progesterone and estrogen start to dip out of the conversation 30s. Testosterone can vary, honestly, because in our teen years, depending on how active we are and stuff, depends on how high we get that testosterone. If you're somebody that's a gym rat, you're naturally going to have a higher testosterone anyways. But I would say every woman that we come in and have tested, their testosterone's still suboptimal. So you have some, but it's not going to be enough to actually do the job of what you'd like it to do. While you're going through perimenopause, again, those lowers just get even lower. We don't get back up to the normal highs. And then menopause, it's off. Like, they're gone. They have completely basically exited the conversation. How we decide that with lab work too. So with your estrogen, we know where our optimal range is. We know that once that leaves, then we don't have those cycles anymore. We can confirm that on lab work with your FSH, or your follicular stimulating hormone. So your ovary is going to send out a signal to release an egg. Well, once we're out of eggs, it never gets that negative feedback to stop sending that signal. So that lab value skyrockets. That usually then coincides with a low estrogen. It usually drops below 10. We don't usually want it dropping below 20. So you can see right there of, okay, if we're suboptimal, that's when we have the risks of heart disease and osteoporosis, brain health. So your memory, your cognitive function, all that starts to you start to see that snowball because estrogen has literally just deuces.
Yeah.
Toodaloo. And then your testosterone is suboptimal.
Right.
So now you're not recovering, you're not sleeping good. You're starting to see all the signs because now we're at bottom.
Right.
They're gone.
This is kind of the opposite, but I feel like it's something you hear about a lot now. But what is estrogen dominance?
So you can have estrogen dominant cells. So usually you hear when it comes into conversations with breast cancer, because you can have an estrogen dominant breast cancer, so they'll usually say like E2 positive or E2 negative, in correlation with doing your hormone scans, or if you choose to do hormone therapy. Studies now show that that does not increase your risk of breast cancer. It actually lowers, because if you think about, those cells are not getting that hormone feedback, so then they dysfunction.
Oh, and then that causes...
Yeah, and that also plays into like the pelvic floor and all the stuff we're going to talk about, because it's like estrogen supports vaginal tissue. So when we lose estrogen, that tissue doesn't know how to function. It's never getting that receptor feedback. So what does it do? It shuts down. So then it dysfunctions. So it doesn't stretch. It doesn't have the elasticity. It doesn't have the lubrication. It just doesn't function like it used to, because that's all hormones. Testosterone, if you don't have enough of it, you can't build muscle. Best indicator of longevity in life now is how much lean mass do you have. So cardiac testing aside, BMI aside, how much muscle, how much lean mass do you have on you is going to be a better indicator of your longevity, because it's also protecting your bone structure.
Yes.
After 30, it's really hard to put it on because we lost the hormones.
Interesting.
So you want to try to bulk up as much as possible, but we don't tell our 20-years that, because they don't know.
Well,
we don't talk about it.
It's just really interesting thinking about that, because in your 20s, you just, you want to look good, right? And that's, with fitness wise, like this is why we should be promoting more strength training.
Yes.
Especially in our 20s, 30s and beyond,
yes.
all throughout life, we should be strength training, lifting heavy things and putting them down, right?
Yes.
Because like what you just said, it's so important.
If I can get you to have more lean mass, you are protecting so many more of your cardiovascular structures, your bone density, and that's why then longevity, because I can perform at a top level because I've done the work ahead of time when I could bulk it up. But we don't talk about that. It's always like, HIIT classes or cardio. And it's like, those are great.
Yeah.
I'm not saying don't do them. But what we really got to be doing is the strength training, picking up heavy crap and putting it back down, not just the load of being a mom, like physically do the weights. And that doesn't, I think a lot of women are worried that they're going to bulk up too. And it's
we are physically not able to do that unless you do it for years.
Even if you do hormone therapy, still, the amount of protein and stuff that you have to eat, like it's a lot of work.
Yes.
So even if you're just doing a 30-minute walk and you throw on some weights, ankle weights, wrist weights, just put on some resistance. Moms, you got a busy life, throw on a weighted vest.
Oh, yeah.
Do your regular routine, just wearing a weighted vest. Mm-hmm. You're giving yourself some resistance. You're putting on some lean mass. That's protecting your heart health and bone health.
I love the idea of doing two things at once, right? Because we are so busy. Exactly. I feel like a lot of us, and this is kind of going on a tangent too, I guess, but it's like one of those things where I feel like a lot of women want to do just like, we feel like we can only do, okay, now I got to do strength training. I got to do this. I got to do this. I got to do this. But if you can like incorporate these things together, yes, you can do laundry and put on a weighted vest and, and listen to a podcast at the same time and improve your mental, thought
If you have little kids, guess what? They're your weights.
Yeah. I know.
You're picking them down, squat down. Just do proper body mechanics when you're doing those movements. And now you just got that into.
Right.
Not that you want to see your children as weights, but
I did.
They work.
Yeah, exactly.
Even last year, I just kind of needed a mix up in my workout routine. And so I was still doing some workouts, but I just felt like I needed more like mobility in my life. But I'm like, I don't want to lose the strength that I have either. So I started doing 50 push-ups a day, but it wouldn't be in a row. That was maybe something I could work up to. I would just set my watch alarm for 5 times a day and I would just get down and do 10 push-ups. And it's like, that didn't make me sweaty. It didn't take a 30-minute block in my time.
Didn't have to change.
Right. Mm-hmm. I was just like filling up the sink to wash dishes and I would just do 10 push-ups quick, stand back up, start washing dishes. And so, I don't know, I like the idea of being able to incorporate it easily into your life.
If you break it down like that, it's so much more doable than pack a bag, go to the gym, do the workout, shower, come home. Like that takes a lot more time. Versus, okay, once an hour, set a timer on your phone that you do squats for a minute. Yeah. Doesn't matter how many, just do them for a minute. Once an hour.
Well, and just think too, okay, now we're getting into it too. It's even if you're a desk job or if you sit or, whatever, if you're just not moving a lot, even doing 10 squats every hour or walking or doing jumping jacks or something, that's going to improve not just what we're talking about, lean mass, blood sugar regulation. Mm-hmm. We're talking way more benefits than what you even realize.
Your circulation going, gets it pumped back up to your brain. Mm-hmm. Like if you're in a slump or you're tired, instead of being sedentary, do some squats.
Yeah.
Do jumping jacks, do whatever.
Pelvic floor muscles. Ooh, bringing it back down. So tell us, why did you want to have an entire episode dedicated to hormones and pelvic floor health and intimacy changes? Is this something that you're seeing a lot in your office then? That's a symptom that a lot of people are struggling with, and we're just opening up the conversation. Tell us more about this.
I see it so often, and we do women so dirty postpartum. And then that just stems into that pelvic floor like indefinitely. I 100% believe that every woman, I don't care if you're a C-section birth or vaginal birth, you should get physical therapy to learn how to re-engage that core, how to work that pelvic floor again, how to breathe properly.
Agreed.
Like, you don't think about those things. I didn't think about those things. Ended up going in for PT for some other injury, and the PT's like, you're still chest breathing. Because I had been pregnant so many times over the last 5-10 years that I was still doing it even though there was no child.
Well, and you're like, well, what's wrong with that? What are you talking about?
Yeah. Well, the problem with that is that I'm not engaging my core, and I'm not getting my pelvic floor involved with my diaphragm to do that proper breathing. So those muscles get weaker. So then you don't use them, you lose them.
Oh, I love that. I just love that you bring this up, because like Britt and I, we have that background too in postpartum fitness, and we worked really closely with PTs as well, and just like spreading the word that there are a lot of things that seem normal, but they are not.
And that's just it. Like, talk about it. And it's not just expected. Like, oh, I had a baby, so now I cough, laugh, sneeze, and I pee. I can't go on a trampoline with my kids or go to the trampoline park with them. Like that. Oh, that's just the way it is. No, it doesn't have to be. And that pelvic floor is a huge component then of sexual health and wellness too, because if you can't get that muscle to properly engage and relax when you want it to, intercourse can be uncomfortable. Nobody wants to talk about that either. And it's like, we need to talk about that, because the amount of women that I have come into the office and are told, just use some lube. Okay. You basically told me to put lube on sandpaper. It doesn't fix the problem. And then the woman thinks that there's something wrong with her. Like, I hear all the time, I love my spouse. I want to be intimate with them. But now they almost have a trauma response because intercourse has been painful. And so you can get like that spastic pelvic floor that literally is trying to protect you from that pain, and it clamps down. So now not only is intercourse itself this whole mental game for women, but now you have that backlying thought of it's going to hurt.
Yeah.
So then you brace. Mm-hmm. Then you're tense. You're tight. Well, now, of course, it's going to hurt.
Yeah.
So trying to, it's a mental piece, it's a hormone piece. And like looking at that full picture, it's not as simple, let me give you a pill. Because I know, whether you guys know it or not, a new pill just got FDA approved for libido for women. One, it ain't cheap.
I imagine
Shocking.
not.
Shocking.
Yeah.
I'm not a big pusher of there's a medication for everything. Kind of thing like, oh, let me give you a pill for this symptom. And then a lot of times give me a pill for another symptom or side effect. And we just go down this rabbit hole. Some of those pills are great options if they're hormone-based. Like, nobody also thinks it's mostly estrogen when it comes to sexual health and wellness. Everybody thinks it's testosterone because we think of our male counterparts. Testosterone plays a role, but a lot of it is estrogen, and then like oxytocin, that hormone that makes you bond with somebody and connect with somebody. You need all those pieces. So if something's missing, it's not your fault.
Yeah.
Like, it's literally the female version of erectile dysfunction. You want to do the thing, but just because I want to isn't going to will it into working.
Yeah.
It's a whole mental piece, and that mental load that women carry in general that also plagues our sexual health and wellness. It's really hard to disconnect and focus on what we're attempting to do.
This is such a hard,
I have so many questions.
Is so hard.
Yeah.
But I also love that you're bringing up that this can be something that's impacting women because they didn't have the proper care after having a baby.
Yes.
But then what you're saying is, though, even if you went through PT and you really had a good foundation of your core and your pelvic floor and you're able to relax and contract and you have just a really good foundation, but then you start going into perimenopause and these hormones start changing, you could start having these types of symptoms here too.
Yes. So it is like this lifelong trajectory, the recovery we go through after postpartum, making sure we heal right, because I don't know how many times I will make it as uncomfortable as possible for guys in the delivery room when I'm giving those discharge instructions, because 6 weeks of nothing in the vagina, okay? I don't need to tell the mom that.
Oh, yeah. She's like,
she's like, can we extend that?
Yeah, right. Exactly.
So I'm not making eye contact with him. I am making awkward eye contact with the husband going, hi, hey, this is for you, homie, because she's not the,
she's not going to, yeah.
So it's nothing in the vagina for 6 weeks, okay? That's fingers, toys, tip. I will make it awkward and because I need to hit this home. This is for her health and wellness. We need time for that tissue to recover, to come back together, not be traumatized, and not have you bugging her. Like, for Pete's sake, just wait. Because hormones then are too also cascading and fluctuating after a baby. So there's so many pieces. But just wait. And we need that 6 weeks to truly heal.
Yeah.
And if you give that, then it also gives the pelvic floor time to figure itself out, because it just got the biggest workout of its life, stretched and expanded, and now it's trying to pull back together. Same with abdominal muscles. Those get ripped apart and then come back together.
Right.
Like, there's so many pieces. It took you a year to grow that baby. It's going to take a year for things to come back together. At least.
Yeah.
Give it time, and don't put pressure on yourself, because now you're a mom too. So add that to the load.
Yeah, no kidding. Wow.
So heading back into the perimenopause piece of it, though, what are some of the common changes in this arena that women are noticing? So you've kind of mentioned like your libido might get lower because of the hormone changes, more dryness.
Yep.
Right? Is there anything else that people should be looking out for?
Tissue laxity.
What does that mean? Like, what does that feel like?
Shannon and I just had a conversation on one of our go lives. I'm like, this is going to go so sideways so quick, because nobody wants to talk about it.
Okay.
You go to have intercourse with your partner, and we've all been there. We all know it, that they try to initiate and tissue is getting pulled in with.
Okay.
The labial laxity can make a huge difference in just being able to be intimate. So, like, every guy does it. It's like, hey, I move tissue on one side. There's two sides, my friend. Like, hi, make this easier and less awkward for the female. That labial laxity just ends up creating almost like a door that is just harder to actually be intimate. So yeah, you're ready, but now it's this awkward, especially if you're with a new partner or something like that. Like, now I have to tell them that I have lax tissue and that I need things moved or adjusted so that it's comfortable for me to accommodate. And I don't know how to have that conversation, because nobody talks about that either.
Yeah, that's true.
So then you just think it's just you.
That's true. I feel like that would be something where it's awkward to tell, because they wouldn't understand.
No.
You know, and even,
which is fair. They don't have it, so they don't know. But
well, and a lot of women wouldn't even know they have it either. They just feel like it's normal, or
especially after kids, because let's just be real, things just don't go back to what they were before. It's just how it is. But now I don't know my own body, and I don't know how to adjust or accommodate for it to make it easier, because I'm now learning it, and now I'm trying to learn it with somebody else. But their anatomy hasn't changed, so they don't understand why it's different and why it's difficult or it's changed.
So if a guy was listening to this, if a husband was listening to this, how could they support a woman through this? Would it be asking her more questions and how she's doing? Like, tell us more about how,
in the bedroom.
What can he do?
Yeah.
Literally, communication, guys. And there's so many great apps out there too. Like, if that's an uncomfortable conversation for you, because it is for most women, because we come from a generation where we didn't talk about things. Keep it under wraps, hush, hush. So now you think you're the only one, so you don't want to bring it up. If there are so many apps that will kind of give that prompt to help guide that conversation, but if you're at that point in your relationship where you can just be open and candid, just start off with, what are some things that I can do that are going to facilitate or make it easier for you to stay in the moment, not be distracted, and that it's going to be comfortable?
I'm thinking too, because you're talking to the men here, right?
Yeah.
Like, if you're in a partner relationship where you really care about the other person, which I would think you are if you're having sex with them, right? But I would think that man would want to make sure that their woman is comfortable.
Yes.
They want her to want to do it again,
yes.
you know? So it's,
and they don't always know the questions to ask,
right.
Or again, they don't have the same anatomy.
Exactly.
So they don't know, and let's be real, like, we don't do great about teaching anatomy and stuff too for our kids either, that we touch base on it in health class and then it kind of goes away and then you only worry about yourself.
Right.
So it's like, how do we have a better conversation and support that? Just start off by being open. And I love AI. If you don't know how to have that conversation, throw that crap into ChatGPT.
There you go. I mean, honestly.
And it will help guide that conversation. And then you can literally have their response, put it in, and it really just grows from there. So it at least gives you a starting point of how to initiate and be receptive without being defensive.
Yeah, because it's not about the man not giving her pleasure.
Correct.
It's not about that.
No.
It's about her feeling comfortable and wanting to do this.
And confident. Because it really derails the whole thing if you are thinking about it's going to hurt, or I need to move, or how do I ask that something be adjusted or changed?
Right, which position.
Right,
yeah.
or now they're taking it personal. It's like, nobody's taking anything personal. It's not, nothing's wrong with you. There's nothing wrong with him. It's just, how do we make the pieces fit together better and easier if we have a conversation beforehand? Now we don't have to have a conversation in the middle and derail whatever momentum we got going of, okay, so now tell me what the playbook is. Like, what am I doing? Like, no, that's not helpful. have it beforehand, and then it just makes everything smoother.
Yeah,
Well, and
for
we
sure.
will be having, we'll be having the same conversation in episode 4 when we're talking about andropause.
Yep.
Because guys are going to be going through some things too. And so open communication is going to be important. But before we finish out this episode, you're talking about laxity. Kegals seem to be the answer for everything when it comes
Always
to
Kegals.
vaginal health, right? Or just, there's a problem down there, do some Kegals.
Kegals.
We're all rolling our eyes here.
I know, because Dre and I, with our background too, we're like, false. Oh, it gets us so frustrated. But anyway, we want to hear your take on, do Kegals actually play a role in this season? And tell us more.
Kegels are great, but you can't out Kegel a hormone imbalance. So you can't Kegel it away. It just is what it is. Also, how many women aren't doing Kegels right?
That's true. This is why we
Trying
see
to
the
find
pelvic
that
floor
right
therapist.
muscle group, that right movement, but then it's also strength and endurance. There's 2 pieces to that. Sure, you can hold it. How long can you hold it? And then when you go to relax, can you fully relax? So you have to work on multiple components of that. And most people, again, aren't doing the Kegels like they're supposed to because they don't know how. Versus if you do something with a pelvic floor therapist where they can tell you, hey, you're engaging it. Or some of our treatments that do the Kegels for you, like great conjunction, come in and do that treatment. Now you know what that feels like. So then when you go to that pelvic floor therapist, you are actually knowing what to engage and where it feels right. So you're doing the work correctly and actually getting some momentum from it. But there's so many pieces to that. Sure, go ahead, keep doing your Kegels, but...
Right. I mean, and there's a time and place, like seeing a pelvic floor therapist, they'll either tell you like, yes, do Kegels and this is how you do it. This is why it's going to improve. And some will say you are way too tight up there or whatever. And these Kegels are not a good idea.
Well, that comes back to that sexual
Right.
health and dysfunction of the PTSD of if you're clamping down, you might need dilators.
Yeah.
And that slow progression to get your pelvic floor to relax and not recognize it as trauma so that you can engage in intercourse that is comfortable and fulfilling without being painful and traumatic.
Yeah. That's so good.
But that's exactly what we're going to be talking about in the next episode, of some of the solutions
Yes.
for problems just like this.
Yes.
But before we close this one out, tell us, how can people find you on social media? Where are you at?
So we are at WishLaneAesthetics.com, WishLane Aesthetics on Facebook or Instagram or TikTok, and you can DM us from any of those pages or text us at 920-512-8822.
Okay, great. And we mentioned this in the last episode, but I'm going to mention it again. They do offer a free consult. So if you're sitting here feeling like you're suffering in silence, but you just want someone to talk to, give them a call, talk through your symptoms, and go from there.
Let us help.
Yeah. All right, you guys, we are going to be coming back next episode, continuing this conversation. And then, like we've said multiple times, 4th episode is going to be about the guys. So we have some awesome ones coming up. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.